everyone. Welcome to another exciting edition of Hematology and Blood Transfusion Science Lecture Series. We are going to be continuing with our series of multiple choice questions on different topics we've handled on supply chain management system. And today we are going to be focusing on product selection and quantification of health commodities. My name is Dr. Ifeoma Mary and Kafu from the Department of Hematology and Blood Transfusion Science, Faculty of Medical Laboratory Science, College of Medical Sciences, University of Calabar, Nigeria. Thank you very much for being part of what we are doing so far. Thank you for subscribing to our channel. Thank you for your feedback. And if you have not yet subscribed, please, this is the right time to do that. Thank you very much. Our first question says, quantification involves which two main processes? Quantification involves which two main processes? We have procurement and delivery, forecasting and supply planning, demand and supply analysis, product selection and utilization, none of the above, and our answer is B. Quantification involves two main processes, forecasting and supply planning. What is the role of quantification in logistics? We have A, identifying funding needs, leveraging funding commitments, advocate for additional resources, ensure continuous supply of commodities. E, all of the above. And our answer is E, all of the above. Which step is involved in quantification preparation? Which step is involved in quantification preparation? We have describe the program, define the scope of the exercise, collect required data, all of the above, none of the above, and our answer is D, all of the above. Our answer is D, all of the above. What type of data is collected for forecasting and supply plan during preparation phase? What type of data is collected? We have consumption data, demographic data, mobility data, service data, all of the above. And our answer is E, all of the above. What is the first step in quantification? What is the first step in quantification? We have forecasting, supply planning, preparation, data analysis, none of the above. And our answer is C, preparation. Preparation is the first step in quantification. We have three steps: preparatory step, forecasting, and supply planning. Okay? If the number of full block counts conducted on the ABS micros machine last year was 420,000, and the machine requires 0.05 liters of milliliters per test, if the scale-up rate for full block count is 10% next year, how much milliliters will be required? A, we have 22,000 liters. B, we have 10,000 liters. C, we have 11,500 liters. D, we have 23,100 liters. 4, we have 33,000 liters. And our answer is D, 23,100 liters. So let us look at how we got that 23,100 liters. Remember our formula? It says number of tests conducted times usage rate per test times growth factor. That will actually give you the forecasted quantity. That will give you the how much milliliters that will be required for the next year. So we have 42,000 times 0.05 liters, which gives us 21,000. And you multiply this by the growth rate, which is 10% growth rate, and you have 23,100 liters. So our answer is D. Another question says, last year, 30,000 liters of mileage were used on all ABS micro machine. And if the trend remained the same and we anticipate a 10% growth in hematology testing, how much mileage will be required for next year? We have 31,000 liters, B, 32,000 liters, C, 33,000 liters, 34,000, we have 35,000, and then our answer is 33,000 liters. So let's just look at how we got that 33,000 liters. Remember, our formula says forecasted quantity is amount of product used or issued previously times growth rate. And what we have here is amount of product used is 30,000 liters. And our growth rate is 10%. So we multiply 30,000 liters by our growth rate. And we have what? 33,000 liters that will be required for next year. Okay? What is commodity forecasting? We have estimating quantities of commodity needed by a program over a particular time. B, planning the delivery of commodities, managing inventories, ensuring product quality, estimating quantities of commodity needed by a program over a particular time in future. Our answer is E, estimating quantities of commodity needed by a program over a particular time in future. Which data is used as a proxy when consumption data is lacking? Service data, issue data, mobility data, demographic data, none of the above, and the answer is B, issues data. What is the formula to calculate the forecasted quantity using consumption data? What is the formula to calculate the forecasted quantity using the consumption data? And we have previous usage times growth factor, targeted population times usage rate, service data times consumption data, stock on hand times lead time, none of the above, and our answer is A, previous usage times growth factor. If a region has a population of 5 million and 25% are adults who require 3 tests per annum with a usage rate of 0.04 liters per test, what is the annual requirement of the reagent with a 10% growth rate? 150,000 liters, B, 165,000 liters, 170,000 liters, 175,000 liters, 180,000 liters, and E, our answer is B, 165,000 liters reagent that is will be needed. And this is how we obtain that. Remember our formula using population data, targeted population times standard treatment guide times usage rate and times growth rate gives you the forecasted quantity. That is the targeted population times the standard treatment guide lines times the usage rate times the growth rate gives you the forecasted quantity. So we have here the population is 5 million, and out of this population, you have 25%. So you need to calculate the percentage of adults from this total population, and then you use the formula as indicated here. So 5,000 out of 5 million people, we have 1,250,000 adults. Okay, you can do the calculation and then you'll find it. And then to calculate the number of tests, you now multiply that with the standard treatment guideline, which is 3. And then you have the usage rate, which is 0.04. And then the growth factor. By the time you do all that, you have your answer. And then the answer is B, 165,000 liters. Okay. What is required to calculate the forecasted quantity for service data? What is required to calculate the forecasted quantity for service data? We have number of tests conducted, usage rate per test, growth factor, all of the above, none of the above. And from what we have here, the answer is D, all of the above. Demographic data does not tell the number of units consumed, but instead is info about disease, Commodities, people, services, none of the above. Answer is C. Demographic data gives you the information of the people, targeted population. It deals with people. Assuming 100,000 full block counts were conducted last year, and the usage rate of mileage per test is 0.05 liters. What will be the forecasted quantity of mileage needed for next year with a 5% growth rate in testing? Okay, we have the answers here: 4,750 liters, 5,000 liters, 5,250 liters, 5,500 liters, and we have 6,000 liters. And our answer is C, 5,250 liters. And remember our formula: number of tests conducted times usage rate per test times growth factor. When you put in all these things, you should be able to do what? Arrive at our answer, which is what? C. The answer is C, 5,250 liters. Which formula is used for demographic data forecast? We have disease incidence and treatment guideline times growth rates. We have consumption rate times standard treatment guidelines times growth factor. We have number of visits times population ratio. We have target population times standard treatment guidelines times usage rate times growth rate. And we have none of the above, and our answer is D, target population times standard treatment guidelines, usage rate, growth rate. Okay. A laboratory conducted 50,000 full blood counts last year. If each test requires 0.1 liters of a reagent and the growth rate is expected to be 8%, what is the forecasted amount of reagent needed for next year? Okay, we have 5,200 liters, 5,300 liters, 5,400 liters, 5,500 liters, and we have 5,600 liters. And our answer is C, 5,400 liters. So remember our formula: number of tests conducted times usage rate per test times growth factor will give you the forecasted quantity. And here goes the calculation. The 50,000 times 0.1 gives us the 5,000 tests. And then to calculate the total reagent needed, we have to multiply it by the growth factor, and then we have 5,400 liters, which is C. What are forecasting assumptions based on? What are forecasting assumptions based on? A, expected uptake in service, compliance with treatment guidelines, program policies, all of the above, none of the above. And our answer is D, all of the above. Which area is considered for building assumptions in laboratory services provision? We have testing protocols, instrument utilization, service contracts, number of working days, all of the above. And our answer is E, all of the above. If a new program targets a population of 4 million, with 10% being eligible for one test annually, using 0.02 liters of a reagent per, and the growth rate is 12%, what is the forecasted reagent required? We have A, 8,800 liters, 9,000 liters, 9,200 liters, 9,600 liters, 8,960 liters. And our answer is E, 8,960 liters. Okay, and remember our formula: targeted population times the standard treatment guidelines times the usage rate multiplied by growth factor gives you the forecasted quantity. There goes the calculation. And if you're able to put in the values as you should in the formula, you should be able to arrive at our answer, which is what? E, 8,960 liters. What methodology is used to calculate mobility data forecast? Consumption data, demographic data, service data, supply planning, none of the above, and the answer is B, demographic data. Which factor impacts forecasting? We have seasonality, geographic variations, service capacity, all of the above, none of the above. Can you guess the answer? The answer is D, all of the above. What is used to reconcile different forecasts? We have comparing final quantities, adjusting assumptions, averaging different forecasts, all of the above, none of the above. And the answer is D, all of the above. Which data source provides population characteristics and trends? Which data source provides population characteristics and trends? And we have mobility data, demographic data, consumption data, service data, none of the above. And our answer is B, demographic data. Okay. Which data helps in identifying the funding needs for procurement? Which data helps in identifying the funding needs for procurement? We have consumption data, forecasting data, supply planning data, all of the above, none of the above, and our answer is D, all of the above. Consumption data, forecasting data, and supply planning data. Which is not a source of forecasting assumptions? Which is not a source of forecasting assumptions? We have service capacity, provider behavior, client access, instrument downtime, none of the above, and our answer is E, none of the above. What helps in ensuring procurement is coordinated with forecasted supply needs? We have consumption data, forecasting, quantification, supply planning, none of the above, and our answer is D, supply planning. Which type of data includes program targets? Which type of data includes program targets? We have consumption data, demographic data, mobility data, service data, all of the above, and the answer is D, service data. What is the result of multiplying the number of tests conducted by the usage rate per test? What is the result of multiplying the number of tests conducted by the usage rate per test? We have growth factor, forecasted quantity, service capacity, stock on hand, none of the above, and our answer is B, forecasted quantity. Which factors should be documented as part of forecasting assumptions? A, we have expected uptake in service, provider behavior, service capacity, geographic variations, all of the above, and our answer is E, all of the above. Which method is most complex and time-consuming for forecasting? Which method is most complex and time-consuming for forecasting? Consumption data, service data, mobility data, demographic data, none of the above, and our answer is C. What should be done if different data sources yield significant differences in forecasted amounts? We have check assumptions and data values. Use one data source only. Ignore the differences. Adjust the forecast randomly. None of the above. And our answer is A, check assumptions and data value. What type of data is useful when you have a new program with no historical data? Consumption data, service data, mobility data, demographic data, none of the above. And our answer is D, demographic data. What does the forecasted consumption for each product depend on? What does the forecasted consumption for each product depend on? We have historical data, growth factor, consensus on assumptions, all of the above, none of the above, and the answer is D, All of the above. Which step involves assembling a quantification team, forecasting, preparation, supply planning, data analysis? None of the above. And our answer is B, preparation. What is the purpose of collecting data during the preparatory phase? For forecasting, for supply planning, to define the scope of the exercise, both A and B, none of the above. And our answer is D, both A and B. During preparatory phase, we collect data for forecasting and supply planning. Which data is used to estimate the total unmet needs for a service? Consumption data, service data, demographic data, mobility data, none of the above. Answer is C, demographic data. Which data is used to estimate the total unmet needs for a service? Consumption data, service data, demographic data, mobility data, none of the above. And our answer is C, demographic data. Which data source would you use to identify trends and patterns in commodity usage over time? Trends and patterns in commodity usage over time. We have consumption data, service data, demographic data, mobility data, none of the above. And our answer is A, consumption data. Which data is most useful for quantifying commodities for long-term supply plans? We have consumption data, service data, mobility data, demographic data, none of the above. And our answer is A, consumption data. What does service data capture in relation to laboratory tests? What does service data capture in relation to laboratory tests? We have number of tests conducted, types of tests conducted, frequency of tests, all of the above, none of the above. The answer is D, all of the above. A program plans to serve a population of 6 million, where 15% are expected to need 2 tests per year. If each test uses 0.03 liters of a reagent and the growth rate is 10%, what is the forecasted amount of reagent needed for the year? We have 54,000 liters, 59,400,000 liters, 60,000 liters, 63,000 liters, 66,000 liters, and our answer is B, 59,400 liters. And remember our formula, targeted population times the standard treatment guide times the usage rate, and then multiply by growth factor will actually give you the standard there, the forecasted quantity. So you need to input the values, but you know that you first of all calculate the targeted population from the 6 million. So 15% of the 6 million should give you the targeted population, and then you now use that to calculate the rest. Last year, a clinic performed 80,000 tests using 0.02 liters of reagent per test. If the clinic expects a 20% increase in the number of tests next year, how much reagent will be required? And we have 1,600 liters of reagent, 1,700 liters of reagent, 1,800 liters, 1,920 liters, 2,000 liters, and our answer is D, 1,920 liters of reagent. And remember our formula for this? Number of tests conducted times usage rate per test times growth factor. Okay. We have a hospital uses 0.08 liters of a reagent per test and performed 25,000 tests last year. If the number of tests is expected to increase by 15%, how many liters of the reagent will be needed next year. Remember, for you to understand all these calculations we are doing very well, you must have listened to the main lecture. You must have listened to the main lecture. That will help you to do what? To understand the formula that we're using. Because I'm not really taking time to show you how all this is calculated here. But if you listen to the main lecture and then you come back to answer these questions, you should be able to understand them better. Okay? So here we go for this particular problem. The answer goes this way: 23,000 liters A, 2,800. The answer goes this way: 2,300 liters, 2,800 liters, 2,900 liters, 3,200 liters, and 3,500 liters. And our answer is B, 2,800 liters. Okay? And remember the formula for this particular one is number of tests conducted times usage rate per test times growth factor. You should remember our methodology for quantification using consumption data, service data, demographic data, and what? Mobility data. And you know that each of them have its own specific formulas. So it's those formulas that we're applying here to solve these questions as the case may be. Okay? If a health center has a population of 2 million and 30% of population requires 1.5 tests per year, using 0.05 liters of reagent per test, what is the forecasted annual requirement of reagent with a 5% growth rate? And we have 35,000 liters, 37,800 liters, 40,000 liters, 42,000 liters, 44,100 liters. And our answer is B, 37,800 liters. And the formula is targeted population times the standard treatment guidelines times the usage rates, and then overall multiply by growth rate gives you the forecasted quantity. A diagnostic center conducted 120,000 tests last year, each using 0.05 liters of reagent. If the number of tests is expected to increase by 12% next year, how much reagent will be required? And we have 6,000 liters, 6,200 liters, 6,500 liters, 6,720 liters, 7,000 liters, and our answer is D, 6,720. And you know the formula for this: number of tests conducted times the usage rate per test, all multiplied by the growth factor, give you the forecasted quantity. Thank you very much for being part of this. I hope that these questions will help you to do your revision and prepare for your exams. Please, we are continuing in the series. Do well to join us in the next edition. And if you have not subscribed yet, please, this is the right time to subscribe. Thank you very much, and thank you.